Kidney disease is known as the silent killer for a reason. By the time most people find out they have it, the damage is already severe, and in many cases, irreversible. The signs are there. They're subtle, often ignored, and dangerously easy to miss. But once you see them, you can't unsee them. Today, we're revealing the top 7 warning signs of kidney disease that you cannot afford to overlook, because recognizing just one of these might save your kidneys and your life. In this video, we'll break down each symptom in detail, why it happens, what it means, and what you should do next. Whether you're already struggling with your health or just want to stay ahead of the curve, this is the video you need to watch from beginning to end. Because by the time symptoms become obvious, it may already be too late. Hi friends, welcome to the channel that's dedicated to helping you protect your health and take back control of your life. If this is your first time here, be sure to hit that like button, subscribe, and turn on all notifications. We share life-saving health content every week, especially around natural remedies, chronic disease awareness, and preventive care. Now let's dive into what could be one of the most important videos you watch this year. Your kidneys are small, bean-shaped organs located near the middle of your back, just below your rib cage. Each day, they filter around 50 gallons of blood and produce about 1 to 2 quarts of urine, removing waste, excess fluid, and toxins from your system. But that's not all they do. Kidneys also help regulate your blood pressure, maintain proper levels of electrolytes, produce hormones that make red blood cells, and keep your bones healthy. So when your kidneys begin to fail, your entire body is thrown off balance. And yet, many people don't notice the problem until these organs are functioning at only 10 to 15% of their normal capacity. That's what makes kidney disease so dangerous. It progresses quietly and slowly. The earliest symptoms are subtle, easy to write off as stress, dehydration, aging, or even poor sleep. But if you pay attention, your body gives clues. Let's go over those clues, the 7 warning signs that your kidneys could be in trouble. But before we do, this video is for educational purposes only and is not meant to replace professional medical advice. If you experience any of the symptoms discussed here, it's crucial that you speak with a qualified healthcare provider. Early detection and treatment can make all the difference. Now let's start with the first sign. If you're always tired, even after a full night's sleep, and find yourself struggling to stay awake during the day, your kidneys might be to blame. Here's why. Your kidneys produce a hormone called erythropoietin. This hormone tells your body to make red blood cells, which carry oxygen throughout your body. When kidney function declines, this hormone decreases, leading to a reduced red blood cell count, a condition called anemia. Less oxygen gets to your muscles and brain, and the result? You feel exhausted, sluggish, and foggy all the time. This kind of fatigue doesn't go away with coffee or a nap. It lingers. If you've been constantly tired and can't figure out why, it's time to have your kidney function tested. Sign number 2, swelling in the feet, ankles, or legs. Swelling in your lower extremities can be one of the earliest visible signs that your kidneys aren't working properly. When kidneys lose their ability to remove excess fluid and sodium from the body, fluid starts to build up, especially in areas furthest from the heart, like your ankles, feet, and legs. This swelling, also called edema, might start off small but worsen over time. It can also be mistaken for weight gain or poor circulation. In severe cases, the swelling can become painful or make it difficult to walk. If this sounds familiar, it's not just an inconvenience. It's a warning sign. Sign number 3, foamy or bubbly urine. Most people don't inspect their urine, but it can tell you a lot about your health. One of the key signs of kidney disease is excess protein in the urine. This happens when the kidney's filtering units, called glomeruli, are damaged and allow protein, especially albumin, to leak into the urine. As a result, your urine may appear frothy, bubbly, or foamy, similar to the fizz on beer or soap bubbles. And these bubbles don't go away quickly after flushing. This is one of the earliest detectable signs of kidney dysfunction, and it often precedes more severe symptoms. A simple urine test can confirm if you're losing protein and whether your kidneys are in distress. Sign number 4, frequent urination at night. Getting up once in the night to urinate can be normal, especially if you drank fluids before bed. But waking up multiple times throughout the night to urinate could signal kidney issues. When the kidneys are damaged, they lose the ability to properly concentrate urine. This leads to an increase in urine production, especially at night. If you're constantly running to the bathroom between midnight and dawn, and it's become part of your routine, this may be more than just an annoyance. It could be a red flag. Other conditions like diabetes or a urinary tract infection can also cause nighttime urination, but if it's persistent, get it checked out, especially in combination with other symptoms. Sign number 5, puffiness around the eyes. That persistent puffiness around your eyes, especially in the morning, may not be from a bad night's sleep. It could be a sign that your kidneys are leaking protein into your urine. When the body loses protein this way, it starts to draw it from your tissues, leading to swelling in areas like the face and eyes. If you've been noticing that your eyes are constantly puffy, even when you're well rested or hydrated, it may be time to get a urine protein test done. Sign number 6. High blood pressure. Your kidneys play a major role in regulating blood pressure. They help manage your body's sodium balance and release hormones that help control it. When the kidneys are damaged, they may struggle to regulate blood pressure effectively. And on the flip side, high blood pressure can also cause kidney damage, creating a dangerous cycle. If you've been diagnosed with hypertension, that's difficult to control. Even with medication, it could be more than just a cardiovascular issue. It might be an indication that your kidneys are struggling in the background. Sign number 7. Metallic taste in the mouth and bad breath. A strange metallic or ammonia-like taste in your mouth can be an alarming sign of waste buildup in the blood, a condition called uremia. When your kidneys can't filter out toxins efficiently, these toxins start to circulate throughout your body, including your mouth. You might find that certain foods taste off or you've lost interest in eating altogether. Some people also develop breath that smells like urine or ammonia, which is often described as having a chemical odor. If your appetite has decreased or food seems to taste strange or unpleasant, don't ignore it. It could be your body's way of signaling that your kidneys are not doing their job. Kidney disease is stealthy, slow, and often symptomless until the damage becomes severe. But your body does send warning signs if you know where to look. So let's quickly recap. Persistent fatigue that won't go away, swelling in your feet or legs, urine that looks foamy or bubbly, waking up multiple times at night to urinate, puffiness around your eyes, high blood pressure that's difficult to control, and a strange metallic taste in your mouth. These are not symptoms you should ignore. They could all point to declining kidney function. If you're experiencing even 1 or 2 of these signs, it's time to take action. Don't wait. Ask your doctor to run a creatinine blood test, check your GFR, and perform a urinalysis. These simple screenings can catch kidney disease early, while it's still manageable and in some cases even reversible. If you found this video helpful, make sure to give it a thumbs up and share it with friends or family, especially those over 40 or with diabetes or high blood pressure, who are at greater risk of kidney disease. And don't forget to subscribe to the channel and hit that notification bell so you never miss a critical health update. We've got more in-depth videos on chronic conditions, natural remedies, and how to protect your health in today's toxic world. Comment below and let us know which of these signs surprised you the most, or if you've experienced any of them yourself.